Hi, my name is Dr. Alizadeh, and I want to welcome you to our practice. I am a board-certified plastic surgeon and professor of clinical surgery at New York Medical College. I've been in practice since the year 2000, and having treated literally thousands of patients in my beloved field of plastic and reconstructive surgery, I can tell you that this is a very exciting and evolving field. I have offices in Manhattan on Park Avenue, as well as Jericho and Long Island, with privileges in Westchester. And so I am involved both in academic surgery, where we are publishing our results and our outcomes in plastic surgery, as well as teaching residents and medical students, and in the clinical field of plastic surgery, where we've been doing FDA trials, research on new product and devices, as well as developing techniques such as the natural bra. The natural bra is a technique that I developed first and presented in the year 2004. And now we have literally over 1,000 patients that we've been doing the natural bra on, and we presented our results at the 100-year anniversary of the American Association of Plastic Surgeons. This procedure basically takes advantage of your own tissue to be able to provide an internal support for the breast that allows you to have a long-term outcome with fullness of the upper pole of the breast, as well as a medial cleavage, while maintaining the shape and the perkiness of your own breast tissue without the use of any implants. We have actually modified this procedure over time for people that want to have more projection by using either an implant in conjunction with it, or by using your own fat when it's combined with fat grafting. I'm also very passionate in performing migraine surgery, which I've performed since the year 2010. And we recently published our results on an aggregate of number of patients that we were able to follow for at least 1 year, who were completely pain-free after having suffered with migraines daily or every other day for a number of years. What we're able to show was that by decompressing these nerves in a very selective way and wrapping these nerves to protect them from rescarring, we're able to potentially cure this very complex problem with patients who've had daily headaches. I do that with the help of my colleagues at New York Medical College, as well as my colleagues in New York City, where we have a group of interdisciplinary doctors involving pain specialists, anesthesiologists, neurologists, internal medicine experts, as well as psychologists and psychiatrists, where we look at the whole patient and their problems. We're able to get together and create a plan for them. And if they're not responsive to medications or medical management, then surgery may be a good option for them. At which time, through an outpatient surgery, we're able to decompress the nerves, again, wrap the nerves in order to protect them from rescarring. And that's been our innovation. And being able to get these patients to become absolutely pain-free. And I'm proud to have patients who are now 12 years after this operation without having had any pain since then. And that's actually one of the most gratifying things that I do in my practice. Another area of very gratifying procedures that I've done in my career is breast reductions for very large-breasted women who traditionally, when they underwent a breast reduction or a lift, they would have beautiful results, but of course they would lose that with time given the weight and the stretched out nature of their breast tissue. So I devised a technique called the natural bra that allows you to have an internal bra, if you will, that supports the breast in a preferred position by taking away the weight of the breast tissue, by lifting it so it gives you more projection and a more perky shape, and maintaining that in position over a number of years. We're able to show the results of our outcomes at the 100-year anniversary of the American Association of Plastic Surgeons in San Diego, California, where we had over 400 patients that we were able to follow over a number of years, and with the longest follow-up being 18 years, showing that you have these incredible results that last a long time. And I encourage you to go and look at these results that are available online. I'm very proud of my career, which really has spanned over 22 years in multiple different arenas of medicine. I started in private practice and became a partner at the largest plastic surgery clinic in the United States. It is actually the largest and oldest clinic in the United States, where I was able to run the practice for about 8 years as its president. I then got involved in organizational plastic surgery, having run the New York Regional Plastic Surgery Society, as well as the New York State Society of Plastic Surgery, and then transitioned to academic plastic surgery, where I was the chairman of plastic surgery at Westchester Medical Center, and then became a full professor of plastic surgery at New York Medical College. Having published over 36 journal articles in peer-reviewed journals and hundreds of national and international presentations, I have developed a passion for academic research. And that really continues to play itself through our involvement with new medical devices, through FDA trials for breast implants, as well as some of the injectables that are used for cosmetic purposes, as well as looking at research that's coming down the pipeline with regards to really exciting things, such as using matrices to replace soft tissue, whether it's for trauma, cancer, or even aesthetic purposes. Having spent a lot of time in the lab, as well as the classroom and with patients, what I've learned is that plastic surgery is a very dynamic field. And to be able to keep up with it, you constantly have to be able to know what's happening in academic research, be able to teach it, be able to write about it, and be able to communicate it to our patients. And that's why I encourage you to always come in prepared yourself, learn everything that you can, write down your questions so we can have a really frank discussion about what's possible, and so that we can make your journey very comfortable for you and very personalized to what you want to accomplish.